partners in the group, we're actually really good friends, which doesn't happen a lot in the medical world. A lot of times it's just your partners and you have that professional relationship. But in our case, we all came together several years ago and we all hit it off, and that really has helped too, because honestly, you can kind of unload if you need to on each other. It's easier to communicate, you don't feel as strained. You have the professional part. Probably the only downside is we sometimes then will let business jump into our more social occasions sometimes and start talking medicine, which then the rest of our families don't enjoy so much. But we historically have gotten together pretty frequently and just to hang out and have fun, and our families get together, and it's been great. It's actually one of the things we joke about is as we're growing, if we need to bring somebody else in, we want to find somebody who's going to fit right in with that group and be able to hang out and have a good time outside of work. I think anytime you like the people you're working with, it's going to make it better. Every part of those interactions is easier. I've certainly been in practices where folks did not necessarily like each other. They were very professional, but it definitely puts a strain, probably more than anything, on some of the other folks that work in the clinic, or other staff and things like that. So when everybody likes each other, it just makes everything flow easier. Everybody gets along. It's easy to communicate. You don't worry about having to call somebody and say, hey, this came up, can you help me with this? It's not a big deal. And same way, everybody feels supported by that too. So it really works out nicely.